Across Texas tonight, COVID-19 hospitalizations remain at 9,401, and 2,400 of those hospitalized are right here in the RGV.
Now hospitalizations have decreased in comparison to last week, but the number of ICU beds has dropped below 35. CBS 4's Bryce Helms spoke with the Cameron County Health Authority to find out why.
Most of the time, patients don't get sent to the ICU immediately after they're admitted to the hospital.
They get admitted to the hospital, they're there for days or a week, and a lot of people get better at that point, but some people get sicker.
Those people who get sent to the ICU.
And so that's one of the big challenges is once a person with COVID ends up in the ICU, they can be there for a very long time.
They stay until they get better, or don't.
In terms of deaths per million people in the population, we are on par with what happened in New York City.
Dr. Castillo says part of the increase in ICU hospitalizations has nothing to do with COVID-19 at all.
And we're also seeing people get in the hospital having delayed seeking medical care until they absolutely have no choice, and that it usually means it's much worse.
Patients only coming to the hospital after they need intensive care is adding additional stress to already taxed hospitals.
The hospitals can create beds, they can get more beds, but what they can't do is easily get more staff.
To limit spread in the hospital, COVID-19 patients are kept separate from other patients.
People should not put off vital medical care until it's out of control. Definitely, you need to get things taken care of before they get out of control.
Working for you in Harlingen, I'm Bryce Helms.
According to Texas DSHS, a quarter of patients in hospitals in the Rio Grande Valley are there because of COVID-19.